you know that there are a lot of different underlying conditions, complications, issues, and a variety of different things that contribute to the onset or struggling with conception or trying to conceive a child. Hello, beautiful world, and welcome to today's video. I'm going to be talking with you about pelvic inflammatory disease and how it can impact and affect infertility. If this is your first time ever visiting my channel and clicking on my video, I would like to say welcome. My name is Kathleen. You can call me Kat. I typically post videos here on this channel every Monday, Wednesday, and Friday at 12 p.m. Central Standard Time. And I focus more on feminine health issues as well as anti-aging, wellness, and just how to live a holistic lifestyle. So if these are things that interest you, I encourage you to go ahead and hit that subscribe button and become a part of my community, and make sure you ring that notification bell. So without further ado, let's go ahead and jump into today's video. So if you have been following along with this infertility series, or if you have infertility, you know that there are a lot of different underlying conditions, complications, issues, and a variety of different things that contribute to the onset or struggling with conception or trying to conceive a child. Today I'm going to talk about an underlying condition that can impact your fertility known as pelvic inflammatory disease. I'm going to discuss and explain exactly what pelvic inflammatory disease is, the common signs and symptoms, how it impacts fertility, as well as what your next steps would be if you do have pelvic inflammatory disease that is contributing to your infertility. Pelvic inflammatory disease is a condition that affects the upper reproductive tract, specifically the uterus, the ovaries, and the fallopian tubes. Some common causes that contribute to the onset of pelvic inflammatory disease is going to be having a prior history of pelvic surgery or any kind of surgery or medical condition that causes damage to the cervix, as well as contracting a sexually transmitted disease such as gonorrhea or chlamydia. When it comes to the signs and symptoms associated with pelvic inflammatory disease, you're typically going to fall into one or two categories. The first category being that there are no outward signs and symptoms that are alerting you to the fact that you have an underlying condition or complication that is a problem. The second category is going to be there are outward signs and symptoms that are alerting you to the fact that there is something going wrong or something amiss regarding your health. So the common signs and symptoms associated with pelvic inflammatory disease is going to be lower abdominal pain, lower pelvic pain, irregular periods, painful urination, having low back pain, also experiencing vaginal discharge that has a strong, fishy odor or scent, as well as having painful intercourse. And in extreme cases, you may also experience having a fever, vomiting, or diarrhea. So how exactly does pelvic inflammatory disease contribute to infertility or cause issues with fertility? It is important to understand that pelvic inflammatory disease in and of itself does not lead to or cause or mean that you are going to be infertile or struggle with fertility issues. If pelvic inflammatory disease is diagnosed early and it's caught in an early stage, or it's a very mild case that can be treated with antibiotics, the chances of you recovering and not having any issues with your fertility is high. Also, as long as you're not having recurring issues with pelvic inflammatory disease, this is also not going to contribute or decrease your fertility. When it comes to misdiagnosed or undiagnosed pelvic inflammatory disease or having recurrent bouts of pelvic inflammatory disease, this is when it can contribute to infertility in the form of adhesions developing on the reproductive organs, such as the ovaries and fallopian tubes, which is going to impair your body's ability to participate in the fertilization process and prevent conception from occurring. you are struggling with infertility and you suspect that you may have pelvic inflammatory disease, or if you know for a fact you have a history of pelvic inflammatory disease, it is super important that you schedule an appointment with your primary care or your gynecologist and you get evaluated and you discuss this with your doctor, so that way you can reach a proper diagnosis. It is only then that you can determine what your next steps are going to be, which is going to depend on your overall health and well-being. It's going to depend on the severity of the pelvic inflammatory disease, or if that's even present, as well as if there's any damage to your reproductive organs. So all of those things is going to determine what your fertility journey is going to look like and what your next steps are going to be, in which your doctor is going to advise you on what you should be doing next. That is all for today's video. I hope that you found this insightful and helpful. If you did, please do me a favor and give me a thumbs up. That helps me out so much. And make sure that you're subscribed and that you're part of the community and that you hit that notification bell, so that way you become aware of any and all of the videos I upload here on this channel. And here is to redefining health and staying forever young. Bye.